new study about the South African variant is a little worrying, although we have to remember that the South African variant is only 1% found in the population of people who are diagnosed with COVID-19. But still, the fact that it seems that the Pfizer vaccine is not as effective with the South African variant as it is with the British variant and the original COVID-19 variant. But still, it's only 1%, so we don't have to be very worried about it, but it really means that the disease is not behind us, although we maybe are approaching the herd immunity. But still, this variant, I think, can be very worrying. And we can't completely forget about the distancing and keeping on masks, especially in closed places, because if people are not as immune after they think they are immune because they got the vaccine, but still they're not as immune to the South African variant, they could contract the disease. So I think we really do have to go on looking after ourselves and keeping distance. And let's hope that it's not as problematic as it could be, but still, we're not scot-free. We're not free from the disease yet.
Well, certainly appears to be some dichotomy going on here within Israel. We're talking about dropping the outdoor mask mandate, kids going back to school at full capacity. Essentially, the virus in many ways disappearing from life inside of Israel. But we know around the world, and certainly in the U.S., elsewhere in Europe, far from that at this point. Are we likely to see somewhat of a fortress situation continuing here, borders closed, and that concern over the entry of variants still being a top issue for health officials in Israel?
Yes, it is a very big topic, I think, because when people start traveling again and traveling abroad to countries where the virus is abundant, it's obvious that new variants will form, and we never know when they're going to come back. So just now, I think we are trying to do our best and checking every person that is coming into Israel, doing a coronavirus at the airport. That's very important, in my opinion, and it seems to be working. I just came back from the United States, and I had to go through the coronavirus, even the test, even though I am immunized. So I think that's very important that people understand that even if they are immunized, they have to do the test and see that they did not bring something new into the country. No, so that point is very important.
Another good development going on here. We heard talk about certainly coming from Pfizer, now data being submitted to the FDA in the U.S. here, that between 12 and 15, age 12 and 15 now, kids may start receiving the vaccine even within the month, perhaps. Here, what's your estimate for how fast that will happen in Israel?
Well, I really do think it's important to do that, and if we get the results that it's really safe to give children the vaccine, which it seems just now like that, if we want children to go back to fully be active in their life like it was before last year, I think we have to try and get the vaccine out there to kids. The only way to get to the herd immunity is really the vaccine. So as we can get to more people, the herd immunity will be achieved sooner. So it's very important to get to these kids and immunize them. They've suffered enough during the last year, and I think it should end, and we should do all we can do to get them back to schools full time with all their friends, all the activities they had before. And the only way to do it is through the vaccine. And even if everybody says, well, kids are not very sick, it doesn't affect them very much, but if they're not immunized, they are the source of the virus to go on being active within the whole community. And it affects the herd immunity, of course.